Almost 200,000 people underwent some sort of bariatric surgery 2 years ago, also known as weight loss surgery. On this week's edition of Today's Health, we see why doctors say the least common surgery is getting a lot of attention thanks to new methods. Bianca Castro reports.
At my highest, I was 267 pounds.
Kanisha Bailey remembers the physical and emotional pain of being obese.
Knee problems. My knee hurt every day. I didn't feel like me anymore.
And when her weight started affecting her role as mom,
At one point, they kind of stopped asking me to do stuff.
she knew she had to lose weight. So she opted for one of the most uncommon bariatric surgeries. It's called a duodenal switch, or D-switch. Surgeons not only remove a large portion of your stomach, they also rearrange your intestines so that your body absorbs very few calories from fat.
This operation, because it's a little bit more technically demanding, is really the last operation to be truly mastered and standardized from a laparoscopic approach.
Hello, Kanisha, how are you?
Good, how are you?
Dr. Jay Roberts says thanks to laparoscopic advancements, the procedure has gained in popularity. Patients have a better recovery, and Dr. Roberts says they also have a better chance at keeping off their weight compared to other procedures.
People enjoy a very durable weight loss with very little weight regain.
It's a procedure he recommends for younger patients like Kanisha, but it does have its drawbacks.
Honestly, one of the worst things is not being able to drink and eat at the same time.
Kanisha has to follow strong diet restrictions to accommodate her now smaller stomach and has to take vitamins and eat low-fat, low-sugar food.
Chicken. Lots of chicken.
But she says it's all worth it, especially now that she's active with her kids again.
I've been called fun a time or two.
In other health news this morning, some good and bad news about diabetes in the U.S. A new Johns Hopkins University study shows diabetes rates nearly doubled between 1998 and 2015. But the proportion of undiagnosed cases dropped significantly from 16 to 11%. Researchers say better screening by primary care doctors is helping diagnose more patients. Untreated diabetes can lead to heart disease and kidney damage. A small new study finds Botox may help kids and teens with hard-to-treat migraines. 9 children were given Botox injections in the front and back of the head and neck every 12 weeks. All of them had fewer migraines each month, and their headaches were less painful. Right now, Botox is only approved to treat migraines in adults. And lastly, African Americans are not living as long as whites. A new study finds blacks lose nearly 3.5 years of life, mostly because of heart disease and stroke. Researchers say risk factors for heart disease like high blood pressure and obesity tend to develop earlier in African Americans. And that's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.